Hi, my name's Shannon Gregoire, and I was the class of 2022 College of Veterinary Medicine. And what drives me is, of course, I think a little bit of perfectionism, which I think we all kind of share in our drive to become a veterinarian, but also my passion for animals and really helping people recognize, when their dogs are, needing something, when they're painful, when they're stressed, when they're happy, and really encouraging them to be an advocate for their own pet because they see them all the time. And so the more informed an owner is when they bring their pet to me, the better the outcome and the quicker the outcome is when we have a fuller picture and more detailed story. And I really love, watching clients, patients, grow up through their puppy stages into their older years, and then, eventually helping them transition when that time comes, if necessary. So it's, I think, a really amazing ability to be a part of your community, and there's a big trust between, your veterinarian and the client patient relationship and that pet as well. So people really hold you in high regard, and I've been really really thankful for that kind of relationship aspect of it. And I really find myself enjoying that part of medicine, not just, the internal medicine or the surgery, but the relationships that you make along the way and the clients that really brighten your day. Maybe like a lot of you, I grew up with all kinds of animals, small animals, exotic animals, horses, all those kind of things. So I got a really broad kind of introduction to a whole different, different types of animals. And I lost a few along the way, like life happens. And I didn't want to feel like I was ever like I didn't know how to help them. And I feel like when you are stressed or in a hard situation, like it's sometimes hard to find a veterinarian. And I wanted to always, know what to do. When you don't have this type of training, you don't really know what's going on, and that can be really scary. And I didn't want to be scared like that with my future pets. And I also wanted to help people not be scared as well, or to help them through that fear and that scary time. With what I wanted to do with my career, um, I knew that I had, different options. You can go back and forth and change course whenever you like. And ownership was always something that was, kind of my future big goal, right? I wanted to have a clinic of my own that I could build into this wonderful general practice that had rehab and that, has traveling surgeons and traveling internists. Maybe we have a scope or a CT, like a really like advanced general practice that utilized our now really popular telemedicine specialists to really bring a lot to our clients in their hometown vet. And so that is still today my big dream, is to have a clinic like that someday. But I graduated and I went to go work for an independent practice not too far from where I lived. And I stayed there for about a year until, I think my goals just didn't align with where they were going. And so decided to part ways a little quicker than I had originally expected. When I first joined, I didn't think I was going to leave at a year, but I know that's statistically very common, but that was never my frame of mind starting there. I started doing general practice relief, vaccine clinic, that kind of stuff, and ended up really liking it. And I found it as a way to do a lot of market research as well. So I traveled to a lot of different places. I worked with a lot of different teams and met a lot of different colleagues and team members along the way. You see how a lot of different people practice medicine, handle their clients, handle their staff. So that also was really good for me to see how, how happy is this team, or how do I like the medicine that they practice here? What kind of standard? Are we at gold standard? Are we, aiming for ivory tower here? Are we more of a low cost community center? So it really gave me a wide perspective on, even in my local area, within about an hour to 2 hours of where I live is how far I'll travel to see all the different ways that medicine is managed and practiced in my area. So I thought that gave me a really nice view of the landscape here. And if I wanted to build a practice here, that was extremely valuable for me. So I ended up finding the practice that I'm currently purchasing, in the process of purchasing, by basically just reaching out and cold calling them and seeing if they needed any help. I ended up interviewing with them first out of school, and then due to factors that are, negligible now, I didn't end up taking the job, but I reached out back to them once I was traveling and asked if they were willing to sell the practice, and they actually said yes. So I started consistently working there. By the time I purchased it, have been working there for about a year. So I really know the team, I really know the staff, and it's something that this place isn't listed on, any kind of broker website or anything like that. It's just word of mouth and someone that I had met along the way. So you never know who might impact your future or what relationships you might form along the way that could totally take your career in a different direction. I can't believe I'm already ready to buy my first practice. I didn't put a timeline or a number on it, and I think that's maybe a big aspect of your career, is that if you have a certain goal or a certain aspiration, like I always think about it and I always, is this going to help me get there? But I don't put a specific path. Like the path to get there to me didn't really matter. It didn't happen the way I thought it was going to be, and it actually happened a little bit faster. But I didn't need it to work a certain way. I just knew that eventually I wanted to get there. With accomplishments, I think, becoming a confident doctor soon after school is really stressful and really difficult. And by no means I'm not perfect, but I still to this day haven't met anyone who is. But I think, striving to get 1% better every day is a huge goal of mine. And it's, brought me far in my career, in my short career so far. But I've done a lot with Vet Candy. I've traveled to a lot of conferences to talk to different people about their research and their different programs and what they're doing. So I've had a ton of fun educating both colleagues and helping them study for the NAVLE. I've helped clients and future clients, learn more about their pets with different YouTube videos and tutorials and podcasts. So that's been truly amazing and something I never would have expected to be part of my career, but I really do truly enjoy that. And I am working towards potentially getting a board certification in canine and feline practice. So that's something I have on the radar for me, starting to book up cases and reports and trying to make my file for someday applying for that board certification, which is something that I think would be truly amazing to offer to my clients and to my community, that they know that I'm really invested in them and their patients' health and happiness long term, and that I can help them with all of their needs, even more so than maybe your average community clinic. It'll be a high level of care and diagnostics and be able to have great outcomes for my patients. The other thing is, buying a clinic so early. That's a huge milestone for me personally. I think I've wanted that since I was in high school. Before I even got anywhere near veterinary school, I knew someday I wanted to be a vet and own my own practice. So that is just truly amazing. And I feel so blessed to have it come this far and this fast. But I think if you really work hard and you have your goals in mind and you always work toward them, you can achieve any goal that you set forth in your career. Along your veterinary education, it's really important to make as many connections and relationships with colleagues that you meet as you can, because our community is so small that even, now if I travel and go to a conference, like there's someone that in common, maybe 2 to 3 people removed, and they either, did a residency together or did an internship or are classmates or they worked at a previous job together. Like our community is so small that you never know who may be able to help you or find a connection for you that you already know. So that's huge. Definitely make a lot of connections, form relationships with each other, and keep in contact with people from school, from your rotations, and check in and see how everybody's doing. And you never know who might be able to offer some advice or some aid if you ever need it. Also, I think really, I know it's stressful. You're always studying and it always feels a little overwhelming, but really try to enjoy every step of the way. Part of me does miss being a student just because you still have a little bit of extra time, more free time than I do as a traveling doctor and future practice owner. But, and it was, being a student for 26 years, that was almost everything that I knew by the time I graduated. So don't rush it away too fast. I know we're so excited to walk across that stage and be crowned as a DVM, but really try to enjoy your journey. Pick your fourth year rotations wisely. I think, if you have a weakness in a certain area or a subject is challenging for you, do a rotation in that area. I think do as many soft tissue surgeries as you can. Get a lot of spay neuter experiences, really helpful. I think that medicine, at least for me personally, came a little bit quicker than surgery once you're actually out in the field. And going through vet school, especially during COVID, I think that might have impacted my experience significantly, but it has been a lot of work to kind of get there and be confident with everything. So as much as you can, kind of identify your weaknesses before you plan your fourth year, and then really choose your rotations based on that, and making sure that you're as well-rounded and confident as you possibly can be. I know you walk off the stage and you have a little bit of fright going into your first appointment, but it'll all be okay. You just got to make sure that you work towards it and knowing your weaknesses so that you can address them and work on them and get better at them is the most important. Make sure that you have an identity outside of being a veterinarian. We spend so much time and effort like becoming this doctor that everyone holds in high regard, but I try to only be a veterinarian when I'm at work. Like Dr. Gregoire exists in the clinic, but she doesn't really exist outside of that, albeit, family and friend issues, but for the most part, I don't broadcast it to, just anywhere. For me, that's a way to enjoy different aspects of my life without everyone having to know, because I do feel like you get a lot of inquiries and questions, and that's not always something that I want to think about when I'm not working, because work can be tiring and mentally tiring. So I like to have time where I'm just Shannon, and I like to go to the grocery store or go to a brewery and just be with my fiance and my dog and hang out with my friends and family, and not be just the veterinarian that people are asking questions to. So for me personally, I really like that little degree of separation where I can focus and love my work, but then when I'm at home, I'm just me and I can focus on what else I love outside of veterinary medicine.